this video, we'd like to discuss whether or not hyperemesis gravidarum can actually cause miscarriages and recurrent miscarriage. Now, many doctors and even patients themselves are questioning whether or not hyperemesis is actually as serious as able to cause a miscarriage or pregnancy loss. Here at Antai Hospital, we can say for sure that hyperemesis gravidarum is in fact one of 43 factors that can lead to pregnancy loss or recurrent miscarriage. It can happen in two ways. The first way is an involuntary way. The second way is a voluntary way. The involuntary way is because of how hyperemesis acts upon the patient. The patient is in a state of malnourishment, dehydration, extreme stress, both mentally, physically. Let's talk about the insomnia, the nausea, the excessive salivation. Systemically, she's under a lot of stress as all her glands and organs are being fired up at the same time. And taking account with the dehydration and malnutrition and her muscle weakness, these all play an important role in causing fetal malnourishment. And what the most obvious factor in causing this is because of the excessive vomiting, causing the uterine muscles to actually contract involuntarily as well, because it's triggered by the constant contraction of the abdominal muscles. If you constantly cough, you are very well likely be able to induce a miscarriage. This is how we see hyperemesis causing miscarriages in women. So the second way, the voluntary way, is that women who have hyperemesis, the more serious ones, because of how severe it is, it's actually life-threatening to them. Their blood pressure is extremely high. Their blood sugar is extremely low. They are losing terrible amount of weight. So they are advised to actually go for an induced abortion, because we do know the root cause of this hyperemesis is actually the HCG that is free flowing within their blood caused by the pregnancy. Once an induced abortion has happened, you can see the patient will have the symptoms relieved almost immediately, almost overnight. You will see them gain their appetite back, gain their sleep back, and then all other symptoms subside. So this is two ways that pregnancy loss can happen. The former being the more common one, because many women are not aware of hyperemesis being a serious factor for miscarriage. They believe it is morning sickness, and especially patients who are first-time hyperemesis patients, it's actually a surprise to them, because they never thought that it can lead to a miscarriage, and even their own medical providers, their own doctors are unaware that it can actually lead to miscarriage. So Antai Hospital offers a highly effective treatment, just like how you see women relieve their symptoms after going for an abortion. Our treatment works very similarly in effectiveness. Our treatment, once administered, you can see symptoms subside within a day or two extremely rapidly, because we deal with the underlying cause. And if you are worried if it affects the baby, don't worry, because this medication is unable to pass through the placenta, so it has no interaction with the baby. So with this medication, not only can you see rapid recovery, you can see that you won't even have the hyperemesis anymore throughout the remaining of your pregnancy journey. It is important to keep note that your next pregnancy will likely have another hyperemesis episode, a much more serious one at that. So at Antai Hospital, we always recommend that for patients who come for treatment for your next pregnancy, you have to come back again and then receive this treatment before pregnancy, so that you don't see hyperemesis at all during your next subsequent pregnancy. So I hope I've answered a few questions in this video about hyperemesis and miscarriage. So if you have more questions regarding this topic, please leave them down in the comments below. Visit our website, set up a consultation. Let's discuss how we can help you today.